Hello and welcome to the Extending the QALY project. My name is Tessa Peasgood and I'm a health economist at the University of Sheffield and I'm one of the researchers on the project. I'm going to talk for about 10 minutes to give an overview of the project and what we've been doing so far since the start of the project in May. So the main aim of this project is to develop a new instrument that can be used to measure quality of life. And what we're looking to develop is a questionnaire that picks up the impact of health treatments and social care interventions on physical and mental health, but also on broader quality of life aspects as judged to be important by the service users themselves and also those who are impacted by interventions such as carers. We would also like the instrument that we develop to be amenable to being scored such that it reflects how important each aspect is considered to be by people. We would also like it to be amenable to being included in future clinical trials, so we need it to be fairly short and simple. And ideally, we would like it if it was easily translated into other languages and could be used internationally. As I mentioned, the project started at the beginning of the May and it's going to run for 30 months until October 2019. The project itself is being funded by a consortium of funders, mainly the Medical Research Council and the EQALY Research Foundation. We also have a large number of project partners within the project. So it's being led by Professor John Brazier, who is based in Charles School of Health and Related Research at the University of Sheffield. And you'll see there's a large number of researchers within Sheffield working on the project, and we all have slightly different experience and expertise. We also have key partners in NICE, the University of Kent, the Office of Health Economics and the EQALY group. So in addition to the project team and partners, we have governance groups which will be very important for the success of the project. We have a steering group that's about 10 people, key stakeholders, and they will meet in person. We also have an advisory group, which is a much larger group that we will be consulting with online. In addition to that, we have a public involvement group. This will be about 10 members of the public and they will be meeting in person at regular intervals throughout the project. And we will throughout the project have some involvement with members of the NICE Citizens Council. So I'm just going to talk you through the different stages of the project. So in the first stage of the work, which covers most of the remainder of this year, we will be trying to identify the domains or the themes that we want the instrument to cover. And we'll be using two main ways initially to do that. One is a large literature review of the qualitative research. And when we say qualitative, we mean in-depth interviews and focus groups with people. And we want it to be around what aspects of life people think are impacted by either their health condition or their health treatment or their need for social care or receipt of social care. So we're looking for research around well-being and quality of life. In addition to that large literature review, we'll also be doing some data analysis on an existing survey that asked a lot of questions around health and well-being. So once we have identified the themes coming out of that literature review and data analysis, we will be consulting with the governance groups and Citizens Council to see what people think about those themes. When we have agreement around those themes, the stage 2 is to generate a long list of possible questions that we could ask around each theme. And we're expecting to come up with a list of about 35 to 60 questions or items. And these will be taken mostly from other instruments, but if necessary, we will write our own new questions. The next stage is to go out to interviews with members of the public and social care users, carers and patients, covering a wide range of backgrounds, and we intend to interview about 50 people. And we're going to ask them firstly to look at our choice of domains and see if they think they're reasonable or if anything is missing, and then go through each question in turn, asking them what they think about them, how they're interpreting them, and how easy they are to answer. And that's a face validity stage. Running alongside that, we will have a large survey of about 2,000 people, again our core interested group of patients, carers and social care users. And we'll ask them about 30 to 40 of our proposed questions, along with some other existing instruments that are used to collect health and wellbeing data, so that we'll be able to make comparisons between our new instrument and some existing instruments. We will then conduct data analysis around that to try and find out how our proposed questions perform and whether or not they measure the chosen domain successfully. So once we have a measure or an instrument, which will roughly be about between 8 and 10 items we expect, but we're not sure exactly how it's going to play out. So once we have that, we will then use one-to-one interviews and focus groups in order to develop scoring for the instrument. And the last stage is really asking questions around the performance of that instrument and what difference it might make to resource allocation decisions if we used a new instrument compared to what's done at the moment. So what has happened so far in the project? We've had an initial team meeting, we've had a couple of workshops with NICE staff, and we've been working to sort of set up the structures of the project and the structures of the governance groups. The team that's involved in the review, the qualitative literature review stage, have developed a research plan or a protocol which was attached in the email that you received. So what would we like from you at this stage? Well, the main purpose of contacting you now is just really to let you know that the project has started, what's happened so far on the project, as well as what our next steps are. We did attach in the email the literature review protocol, which is really just for your information, but if you would like to comment on the protocol, we'd be very interested to hear your views. We'd be grateful if you could use the attached accompanying Google form. Just that way it allows us to collate everyone's responses very easily and people's responses won't get lost. On that form you can also give examples of some existing literature that you might know of, particularly if you think that our search strategy might miss that. So overall, can I just extend my gratitude to you for joining the advisory group. We think the input from the advisory group will be really essential to the success of the project, and I'd like to thank you for listening to this presentation.